Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Drugs that have been proven to be beneficial for individuals with cardiovascular disease are underused worldwide, especially in poorer countries, according to research published in the Lancet. Here is some information about cardiovascular disease. It affects about 100 million people worldwide. About 75% of those living with cardiovascular disease are in low or middle income countries. Little is known about the use of proven drug treatments for cardiovascular disease in the developing world. Researchers from McMaster University enrolled more than 150,000 adults from urban and rural communities in 17 countries at various stages of economic development. The investigators used questionnaires to find out how many of these participants had a history of heart disease or stroke and whether they were taking medications that have been shown to be beneficial following such events. More than 5,600 individuals reported experiencing a coronary heart disease event, such as a heart attack, and nearly 2,300 reported having a stroke. Only about 1/4 of these individuals were taking blood-thinning drugs known as antiplatelets, less than 1/5 were taking ACE inhibitors or angiotensin receptor blockers, only 17% were taking beta blockers, and less than 15% were taking cholesterol-lowering statin drugs. All of these types of drugs have been shown to reduce the risk of having another cardiovascular event and prolong life among individuals with cardiovascular disease. Use of these drugs was highest in the high-income countries and lowest in the low-income countries. In fact, about 80% of those living in poor countries reported receiving none of these drugs. Use was also higher in urban than rural areas, with the greatest disparities between the urban and rural communities occurring in the poorest countries. The economics of a given country had a greater influence on whether an individual received these drugs than did patient-related factors such as how old they were or how many risk factors for heart attack and stroke they had. Today's research suggests that concentrated efforts to increase the use of certain proven, low-cost drugs for the treatment of cardiovascular disease and its related problems could substantially reduce the worldwide burden of this medical condition. For Insider Medicine in Depth, I'm Dr. Susan Sharma.